Welcome to the 5th episode of our Keratoconus video blog. Today I want to discuss a little bit more about collagen crosslinking, something which we began a few weeks ago. In particular, just what is the procedure like for you as a patient? In this procedure, you're entirely comfortable, but you are awake. We use a numbing drop that completely anesthetizes your eye. And in addition, you get a mild oral sedative to take the edge off, so to speak. So you should be relaxed during the procedure. Crosslinking is done in our minor operating room. The beginning of the procedure is done under a microscope. Indeed, really, the only uncomfortable part is looking at the bright light of the microscope. So you don't inadvertently blink. We first place a lid holder. This may apply a little pressure to the lids, but usually is something that's not at all painful. In the standard crosslinking procedure, we first apply a solution that loosens the surface cells of the cornea. You can think of the epithelial cells as being the tiles on the floor, and we need to get beneath these tiles in order to get appropriate crosslinking for your procedure. The solution loosens the epithelial cells, and the cells are easily slid off of the surface. The lid holder is then removed, and the next part is quite easy for you. Simply, you receive riboflavin drops every 2 minutes for 30 minutes. So it is relaxing and comfortable. Period. I do suggest that you might bring along some music to listen during the dropping procedure. You're going to be lying down in a dark room and keeping your eyes closed in between drops. Now, for the epithelial-on or Epi-On procedure, in some cases, we do crosslinking without removing the epithelium. And if this is your case, the riboflavin drops are given every 2 minutes for a total of 60 minutes. No matter how we do the procedure, we assure that there is adequate riboflavin concentration in the cornea in order to achieve a successful crosslinking result. Remember that collagen crosslinking depends on two things: ultraviolet light and riboflavin. If you remember from last week, riboflavin is a photoactive substance that absorbs ultraviolet light at a certain wavelength, in particular 365 nanometers for the physicists out there. This increases the potential of the two components, ultraviolet and riboflavin, to cause crosslinking within the collagen molecules, leading to strengthening of the cornea and diminishment of progression in keratoconus. So after you have received the riboflavin drops, and we're sure that the cornea is completely saturated with these yellow-green drops, the lid holder is then reapplied, and you will look up at the ultraviolet light source for typically 30 minutes. You'll be looking at a central fixation light, and you'll also notice a blue light of the ultraviolet from the light source as well. During this time period, again, you're comfortable. We will continue giving you riboflavin drops every 2 minutes for the total 30 minutes of the ultraviolet exposure. When we're done, we will place an antibiotic and anti-inflammatory drop, as well as a bandage soft contact lens. A bandage contact lens is a therapeutic contact lens, so it's an ultra-thin lens that has no optical power that we use both for your comfort as well as to help the healing of the surface cells. You see the surface cells are shown here, a thin layer of tile-like cells that will grow back over your cornea and heal the treatment area. Typically, epithelial cell healing is done over the next 4 to 5 days, and we will remove your bandaged contact lens when we next see you in approximately 5 days. When you return home, you should note that you will have some stinging, typically lasting for about 3 to 5 hours. I always encourage patients to go home, turn on their TV, close their eyes, and take a nap on the couch. You'll be taking antibiotic and anti-inflammatory drops 4 times a day for 1 to 2 weeks, as well as non-steroidal drops for comfort. We'll also give you tear drops and other drops that you might need to keep yourself comfortable and for other conditions that we might be treating you for. You'll find that vision will be blurry afterwards and will fluctuate over the next 5 days. I liken it to driving on a rainy day with a cloudy windshield or a bad windshield wiper. Sometimes vision can be very good, but sometimes it can be very hazy and blurry. Typically, the epithelial cells, again, are healed in 4 to 5 days. When we take the contact lens off, vision should slowly return to baseline, usually over the next few weeks or month. You may note some haziness remaining over the first few weeks to months, and this tends to diminish as time goes on. Typically, you can return to your contact lenses or get a new contact lens fit with new lenses in a few weeks to a few months, depending on how we see your eye healing. So next week, we'll move away a little bit from cross-linking and get back to that later, but we will be discussing some new laser innovations for keratoconus. I look forward to speaking with you next time, and have a good week. Thank you. Bye-bye.